Okay. So guys, okay, guys, please, guys, if you can hear me on Facebook, please let me know because I believe it could be a little bit of echo. So please, guys, if there is any echo in my voice, please let me know. Okay, I believe it's a good time to start right now. So, guys, while I'm starting right now, I would love to say hi to Jenny. Jenny, how are you going?
Oh, hi. Hello, Dr. Adam. Look, I'm fine, thanks. Would you like me to introduce myself?
Yes, please.
Okay. Well, look, I've been a teacher all my life. I'm not a dentist, but I do have teaching people whose first language is not English. I have those qualifications, and I have been doing it for a long time now. And this is actually session 316 with working with WDA, and it's my privilege to have worked with probably hundreds of students now and helped them to get ready for their Osce exams. So Dr. Adam and I have worked hard to put together the session tonight, and I hope and we hope that it's extremely useful for you. So that's me.
Okay, Jenny, thanks
Dr.
very much,
Adam?
Jenny. And we actually, everyone, including me, we appreciate your hard work toward all the candidates and how you've been very strong, I would say, part in their journeys. And then once you pass the exam, when I ask them what was the most important part toward your success in OSCE, they always say Jenny. So that's why we really appreciate it.
Yeah, thank you. Thank you. I do get feedback from the students too. So it's really lovely. It's really lovely. It's good.
Okay, thanks so much. Okay, guys, being I'm sure everyone attending the session right now, you are bilingual like me, and then I would say English should be the second language, and that's why we have Jenny here. Jenny not just only an English teacher, she's Australian, she's native Australian, and then she's going actually, guys, to tell you more about the culture here because definitely culture can change from place to place. So Jenny will be the best person to tell you how to communicate with Australians in the proper way, the way that they can understand you. Right, Jenny?
I do. I do. That's true.
That's very good then.
Okay.
Okay. So, Jenny, look, we actually, because I know you now only on Zoom, but in the same time, I see the champions here as well on Facebook. So, I always love to say hi to every one of them and then also greet every one of them. So, would you mind to say hi and greet every one of them right now?
Look, welcome to this session. It's really lovely that you have come in tonight, and I'm sure you're going to find it useful for you. So good luck with it. And questions, we take questions too, and Dr. Bedo will look after that side of things while I concentrate on, how to explain clearly what we are doing here. So. Okay, thanks, Dr. Bedo.
Thank you very much. So, okay, so we can start right now, guys. So today it's more about communication skills. And then because even for part one candidates, they may, in the questions, so even for part one, they may use a little bit different language the way they used to do guys overseas. And definitely this is mainly for part two candidates as well, especially in communication skills. But So, okay, let's start right now, Jenny. May me go through the PowerPoint by myself. Jenny, you can see the PowerPoint. Am I right?
I can see the first page. The
Okay.
title. Oh, here we
Now
go.
the second page.
Yeah, I've got it. I've got it. Okay.
Okay,
So,
that's great then. Yes, please.
okay. So, look, when you, I just need to explain to you that when you go into each cluster, it's not a usual, it, I'm getting nervous too. It's not a usual consultation. So what we're going to have a look at first is cluster one. And actually, when you're practicing, it's probably the easiest one to start because you're greeting the patient and you're making a friendly connection. So you introduce yourself by name, say good morning, good afternoon, whatever it is, and make that first friendly connection. How can I help you today? Something like that. It's good to see you. If it's somebody you know, it's good to see you again. Now, this one comes up really often, and I know that that with some organisations, you say doctor, Dr. Adam, uh, Dr. Manquil, etc., etc. But when you're in the clinic, please use the title and the surname, not the title and the first name. So I would not be Ms. Jenny, but it'd be Ms. and my surname. So please remember that. It's important. Now, with names, if somebody comes in and they're your age, younger, maybe slightly older, it might be fine to use their first name. But if you've got an older person, it's better, it's more respectful to use the title and their surname. All right. So they'll probably invite you to say, look, please call me Jenny, please call me whatever it is. If a parent's with a child, please don't say mum or dad. It's just not appropriate. If you're not sure, ask, how do I address you? What do I call you? But please, not mum or dad. Use Mr., Mrs., Ms., Miss, whoever it might be, not mum or dad. They're not your mum or dad. They're the child's mum or dad or uncle or auntie, whoever it might be. So it's just not appropriate to say that. Okay, is there anything further that anybody would like to ask me about this little section to start with?
Okay, Jenny. Look, the questions actually will be on the Facebook. So please, guys, feel free to text us and ask questions on the Facebook, please, guys. By the way, Jenny,
Yes.
I totally agree on this because since the first time ever we got Osce in Australia here was in 2018. And since that time, we actually, the candidates, they do these mistakes. Look, we don't really call it mistakes, but I would say some points they should really care about them, right?
Yeah.
So, and this is the way, even because we have seen this issues happening a lot and frequently.
Yeah.
That's why, guys, we address this parts mainly for you.
Yes. It's important. It's really important. You need to get it right at this point. At this point, the very first point.
Do
Because
you
it's
know why? Sorry, Jenny, you will find being trapped you in
that's all
between.
right.
Would you mind this?
No,
Okay.
not at all. Go on.
Okay. So, Jenny, this actually, it's all about how to build up rapport with the patient, right?
Yeah.
Imagine if you don't address the patient name properly or the title properly. Do you think the patients will respect this communication?
Well, there's that part of it. Look, if you're not sure how to even pronounce somebody's name, and quite often with the candidates that I've been working with over the last quite long time with WDA, they're unfamiliar names to me, and I say, "Am I pronouncing your name properly?" And they'll tell me, and then I'll try and pronounce it properly because it's it's polite, it's good manners. And just ask, how do I address you? Or if it's a name that you're not familiar with, how do I pronounce your name? and try, at least try. Okay. I'm sure I don't get it right all the time. So,
And also, honestly, as well, they actually use the word mom and dad. Hi, mom, hi, and dad. In this case, it's, I believe it's some sort of ignorance. So they ignore you as a person,
yeah.
right? And
Mm.
then they just has specify you to be a dad. But okay, I have my own entity. I
Yes.
am this person.
Yes.
So don't you just ignore this and then
No.
forgive me. I'm not just a mom or dad in this life,
Yes.
right? So I
It's
agree in this
just,
one as well.
it's just more respectful. It's just don't do it. Just don't do it.
Yes,
It's
I
it's not
agree.
it's not appropriate. Please don't do
Yes,
it. So that's our first. That's the first thing. All right. Any other points, questions? Because we've got quite a lot to go with
yes,
today.
yes. I will tell
Okay.
you right now. We just getting here this. I
Yeah.
need to check here. I tell you.
Okay. Do you want me to talk about this one?
Yes, please. Of course, first. Maybe can slide.
Okay. Okay. So you've got to do a bit of a balancing act. Now, I'm a person who has been in the dentist chair many, many times. It's probably an art gallery in my mouth with all the dentists who've had a go at my teeth over the years. So, but when I'm in the chair, when I'm there, it's not just my teeth, it's me. And you're in quite a vulnerable position because you're in a situation where you really have to trust the person with the drill. So try and connect with the person. And it's tone of voice, it's how you say something. It's not just the dental problem that's there. And it could be quite of course, it's a significant dental problem. So, what I think is a really good thing to ask, even if you've got the notes, you can say, what's brought you in to see me today? Please tell me about your problem. Please tell me about the situation that's here today. So just, it's just a small thing, but it means that you can engage quickly with the person in the chair. And even if you've got your case notes, of course you have. And you can say that. You can say, look, I've got the case notes in front of me, but I'd like you to tell me why you've come in today. And that gives you a very quick way to connect with that person because they will tell you, and they might tell you quite a lot more about the background to this. So the last point on this slide here is let them talk and listen carefully. So you need to respond appropriately. All right. So, Adam, can you think of some examples of that? I can, but I
Yes.
just
Look.
wonder if you can too.
Okay. So now, look, the last point, Jenny, which is let them talk and listen carefully, right?
Yeah.
I tell you how important this point. The biggest, I would say, part of this point or the significance in this point, actually, the candidates normally under pressure, under stress,
Yeah.
they mug up some information in their heads, and then they only want to discuss about these points, and because they focus on on themselves rather than the patient, they actually cannot listen and they cannot understand
Mm.
what actually the patient says.
Yes.
And then the patient says right and like right hand side, and then the dentist himself think left hand side
Oh,
because they don't listen carefully. And this is the best example out of it.
yeah.
So what actually they need to do, for example, let's say patient who's having pain for on front tooth,
Yep.
right?
Yep.
And then his concern, not the pain, maybe the cost of the treatment today.
Yes.
And then the dentist actually, or the candidates, only think about the pain because once he start to practice the case, he's just thinking about pain. So when I start this case, I'm going to start like, sorry to hear that, you know, the way they started, right? Sorry to hear that you are in pain today. And we're going to discuss, sorry,
Yeah, we
shortly, we're
are.
going to discuss about, sorry, is it possible to be said or not? like to say it or not. So anyway, so what happened is the candidate just only they have some script in their mind, and
Yeah.
then they say sorry because you are in pain, and then the patient may say, okay, I didn't discuss anything about pain. I'm just only asking you about cost. So
Yeah.
why did you? I don't care about pain. You know what? The tooth is not sore.
Yeah.
So this is as the things happen with the candidates, and then once it starts, the patients actually will not build up rapport with the dentist, and then they lose this connection,
Yeah.
and then the patient will be starting upset from the beginning, right? And then things
Mm.
will be actually getting worse and worse throughout the whole role play.
Yeah.
So I would say, as you mentioned here, let them talk and listen carefully. And
Yes.
then if you don't listen carefully, you and then listen only you must listen to the patient, don't listen to yourself.
Yeah. It's tricky, isn't it? It's really hard because if they talk too long, you've only got 10 minutes with the OSCE. You can't let them talk too long. So it's the transitions between each part of the case need to be managed as well. And I think let them talk and listen carefully, yes. But it's also, I mean, if somebody comes in and there's a case that I do with the candidates where a child has been hit in the face with a hockey stick and has a broken tooth and a displaced tooth. And, you know, when you've got somebody, a father and a daughter coming in like that, those people are really shocked. It's a really traumatic emergency situation. So listen, 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 and, you know, just focus in on those people. The little girl's probably got a horrible headache and so on. So just, you know, just be aware of the situation as well as the problem, because they're very anxious, they're very upset, and it's, you know, I mean that they're not all that extreme. The cases aren't all that extreme, but there are things to respond
You
to.
know, sorry, Jenny, for interruption. I know I shouldn't interrupt you, but sometimes I got points that I may need to interrupt you because I remember something.
Yep.
Do you
Yep.
know yes, sorry for this. Do you know, okay, now you have just given an example for the patients with trauma, that the child with the stick injury, right? The trauma
Yes.
case.
Yeah. Yeah.
Look, here it raises a question for me. There's a question here.
Yep.
If the patient is talkative for any reason, maybe they're under pressure, maybe they're
Yes.
anxious, as you say right now, maybe
Yes.
they anger upset, and then the candidate's worried about the time management, being having these cases in 10 minutes only, must be covered in 10 minutes. Do you think in this situation the dentist should interrupt the patient to stop them, or they should build up rapport and listen to them until they finish talking?
Oh, I think in the OSCE they've got to have something that they say. Look, Mr. whoever it is, um, I can see this situation. I know you're really upset. I think it's really important that we start to look at this in detail and see what we can do right now. And any questions you've got, look, I really want to address this situation now, and we'll talk about this a little bit later. You know?
Yeah, I agree in that strategy.
Yeah.
I always in the clinic because I don't have that much time limits except only patients after patients,
Yeah.
right? It's not an exam. So I let them talk, honestly. I don't trap them at all. And then they may talk for maybe for a minute or two, but this is helping me. That's they get all their stress out,
Yes.
right? And then they calm it down nicely, completely. So they
Yes.
give me a chance to talk for the next 8 minutes or for the next 7 minutes.
Yes.
They get, and so I like the strategy too. Like both of them works fine.
Yeah. Look, it depends on the case. I mean, every case is different.
Yes,
So let's go on to the next one. Anyway,
yes.
now do not say unnecessarily. Now, these three things I have heard a million times. And if I've heard these things, I'm sorry that you're in pain. I will do my best and don't worry, or there's no need to worry. I'm sure the Osce examiners have heard them as well. So what I'm going to try and encourage you to do is to think of something else to say, not necessarily what I suggest tonight, or what Dr. Adams is going to suggest tonight, but just think about alternatives to these phrases, because you tend to go to them because it's at the beginning of your exam and you're uptight and so on. But there's really very little need to say sorry. Sorry is quite a serious word. And we say if somebody has died and you're talking to their wife or husband or whatever it is, look, I'm really sorry to hear that news. And it's kind of too emotional in this situation. You can say something like, instead, look, this must be really painful for you. I can see that this is really painful. Oh, yes, this is uncomfortable. No, we're going to do something about that. Okay, I will do my best. Now, if you just say, I will do my best, it kind of assumes the opposite, that on another day you might do your second best or your third best. Of course, you're going to do your best because you're a professional, you're trained, you've got years of study behind you. So there are other things that you can say. I've got some suggestions here. I've heard these things that candidates have said to me too. Look, I'll take care of you today. You're in safe hands. I'm glad you came to see me about this today. There are many more things that you can say instead of, I will do my best. Because immediately a patient's going to think, all right, if I come tomorrow, is it going to be second best? And the phrase, don't worry. Now, the patient, the client has come in to see you because they are worried about whatever it might be. So it's not a good idea to say, don't worry, there's nothing to worry about. Well, actually, there is. There could be quite a few things. You can say something like, look, this is very manageable. There are many things that we can do. So think about something rather than don't worry. What do you think, Dr. Adam?
Look, I totally agree on this. Definitely. So sorry, it should be a word, should be actually used when you do mistakes, when you do something wrong or something really very emotional.
Mm.
As you said, when the patient pain, you shouldn't say sorry all the time for it.
Mm.
I will do my best. You could say, for example, it's a duty of care. It's part of you are here today, so it's duty of care to look after you. So I'm looking after you today. For
Yes.
example, simple things. Because
Mm.
as you said, in the role play 2 days ago, I believe was a Sunday. Definitely will not mention the name of the candidates, and
No,
we
don't mention the name. Don't
definitely
mention the
I
name.
never mentioned the name.
No, don't
His
do
name
that.
is okay. His name is Sam. Okay,
Okay.
I'm just kidding. His name was not Sam. Okay,
No.
so what
Okay.
I'm saying, yes, I'm just kidding. Don't worry. So okay, guys. So what has happiness, and that's good. Actually, happy because we all learn from each other, right? I got experience by learning. So
Yes.
by myself, I do mistakes in all my life. I still, until this moment, I still do mistakes. So I was actually do role play with him, and he's very good, by the way. But it was good to mention this. He was telling me, "Trust me." He was a dentist, and I'm the patient.
Yep.
And then I said, "Okay, my baby, you know what? I'm really worried to get an X-ray done for my child." And then he said, "Trust me, this is good for you." Or trust me. I said, "Why should I trust you then?" Right? Like,
Never, never say that because you
yeah,
think,
that's what I'm saying.
uh-oh,
He was
uh-oh,
saying he
what's
trusts me.
going on
Why
now?
should I trust you then?
What's going on now?
Yes,
Why?
right. Yes, but look, this is in because I understand definitely because we used to use these words overseas,
Yeah.
right? So it looks like nice in the country there, like in overseas,
Yeah.
it looks like nicer, and then this is somehow we can build up rapport there. But in Australia, I believe this type of words is completely different. Look, I tell you things overseas or back home, most of the country, even you can ask the candidates, let's hear us right now. Everyone hears us right now, they tell you this. In Australia, when you talk to person, you should have eye contact, eye to eye.
Oh,
If you are a
yes.
child, like a child to old man, or old man to lady, or lady to a baby, so all of them they should have eye contact.
Ah, yeah. I hadn't, yeah.
Overseas, this is not respectful. You see the difference in
No,
culture?
no. And the other thing is, some of the candidates may find themselves in Aboriginal communities, and the cultural difference can be quite wide. And it is, I know that that is one of the things with Aboriginal communities that eye contact, especially male to female, female to male, child to adult, um, young adult to older person, eye contact can be really disrespectful.
Yes, exactly. That's happening overseas as well.
Yeah,
So normally what happens overseas is if you going to have an eye contact, mean especially if a child looking at the eyes of an old man, it means like the respect is they should look at the floor.
right. Okay, that's, yeah, that's fair. Yes. Yeah, and that is something that has never come up in all these sessions that I've done.
Yes. So that's saying different culture does make really things
Yeah. Yeah,
differently.
I know that. I've lived in a couple of different cultures to work. Uh, yeah, okay, that's really interesting.
And
That's
by the
good.
way, sorry for interruption as well, Jenny.
Yep.
By the way, they actually the candidate think and the candidates believe if they say sorry a lot, and I will do my best. And this word, this is they're gonna build up empathy, like there's some sort of empathy to the patient, and patient will love them the most, which is definitely
Ah,
not.
yeah. No, they'll have to find some other way to do it.
I
So,
agree.
which we've suggest. Well, I've suggest, instead of sorry, look, I can see this is really painful.
Yes. Now we are on slide 5. Okay, Jenny.
Yeah. Okay. So in the next one.
Yes.
So okay. So uh, the first priority, of course, is to uh, treat the situation. Now you're going to have to, in cluster one, tell the patient that you're asking questions so you can, and so look, I need to ask you some questions so that I can treat you safely, so that what I do is appropriate. Um, is that okay with you if I ask you some questions? All right. So use your common sense. There's often a little list here, and it's going to be the dental problem. Obviously, you're going to talk about that at some length. If medical information is relevant, they'll ask you about your medical situation. If somebody's had a heart attack 6 months before and you're going to do some surgical procedure or whatever you're going to do, it might be a good idea to know that they might be on warfarin or whatever they're on. There'll be all that sort of thing. So there's the dental history. If they say, look, I haven't been to a dentist for 5 years, please don't lecture them. There could be a lot of reasons for that. And don't go on to say, if you can help it, look, you need to see the dentist every 6 months. And the patient can come back and say, well, dentists in Australia are really expensive, doctor. I can't afford that, you know? So there'd be many reasons why somebody has not visited the dentist as they should, or if there could be many, many different situations. But keep listening, keep listening. Habits, if they're relevant, uh, over my experience with all this, obviously smoking is something that's a really serious thing. And I think that most people, including myself when I started doing this, did not really, and I don't smoke, I don't smoke, um, don't understand what it does to the saliva. So, that's something to just sort of keep in the corner of your mind, that look, if you find out they're a smoker, you may need to talk to them later in the consultation about, look, your saliva is part of your immune system, and explain very quickly. Don't lecture them that it has to be. It's much better if it's healthy for your oral health. Okay, so cleaning habits, if it's relevant, briefly. I have a lot of candidates who just get tied up and, you know, uh, how often do you, and, oh, no, I'll do that later. There is some
Okay.
dental jargon going on that I'm thinking of quickly, but don't get too sidetracked with, what kind of toothpaste does he use? Does the child use, or does the child floss? Well, good luck flossing a 5-year-old's mouth. Okay, be practical about this and don't get too sidetracked. All right?
Yep.
Okay. Good.
Okay. So now, in this point, Jenny,
Yep.
tell the patient you are asking questions so you can treat them safely. Why this is important, actually? Because sometimes you need to take the lead. Sometimes you need to explain to the patient what's going on. Otherwise, they may get confused, and after this, they may ask you, "Why do you ask me this question? How this question is relevant to my case today?"
That's right.
Okay,
Yes.
that's one thing, and also about permission. Sometimes, or most of the times, you need to permission because to ask patient about something can be sometimes personally or medical history. We actually consider as I would say it's a private questions. So in this case, again, you need to take permission from the patient. That's why it's important to
Yes.
explain to the patient why you ask those questions. And one of the most important things to make your play very interesting is actually ask for relevant questions because if you're going to ask anything not really relevant, the patient will not be happy with it.
Yeah.
And then they will ask you, okay, and this happens in the role play a lot. And then you
Yeah.
waste the patient time and you waste the dentist time as well.
Yes. 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 And you wasted your time with the OSCE too.
Yes. For
So,
example, if patient come in today because they need to pull out one of their teeth, and then you keep asking about the GP. Have you
yeah,
visited your GP in the last 6 months? What's your problem, man? I'm just here to extract my tooth.
that's right. That's
What's
right.
wrong with my GP?
Yeah. Yeah.
Right? So
It's got
yes.
nothing to do with him or her. And the other thing is that they often say, oh, you go and see the specialist, or you go and see the GP, and it's always him. Just
Yes.
be aware that a lot of women are GPs and specialists as
Why
well.
only him and he? Yeah, him and only him. Yes.
Okay, are we on to the next one?
Okay, let me just get the next one for you, right?
Let's have a look.
Okay.
All right, are we on cluster? Yeah, we've done that bit.
You have already discussed about this.
Closing cluster one.
Yes.
Closing cluster one, we're on.
Would you like to skip this because you already had a little bit of talk on it, or just
No, I
you
think that'll
can?
do. I
Yes.
think that'll do. Yep.
Okay.
Let's keep going. We've got a few things to do yet.
Yes. What
Okay.
about this?
Yeah. Now, at the end of this, just before you finish that first cluster, now, is there anything else I need to know? And there might be something else that the patient thinks of that is relevant. So just ask it, and they'll probably say no, but they could think of something that, really could be important. So just check. It's just a check. And then, thank the patient. Look, this is really helpful. Thanks for answering thanks for answering questions. I know it's a bit of I just needed to know these things before we go next. And then the next steps. Now I'm going to investigate further and so on. Is there anything else, Dr. Adam, that we haven't covered here?
Okay, Jenny. There are some tricks in the exam actually, and then I would say being used by ADC, which is and misunderstanding from the candidates. They think information gathering cluster, which is cluster one, is all about gathering information.
Yeah.
And that's why they only want to keep asking
Ah,
questions.
yep,
And I believe if I put myself in the patient's circumstances or the
yep,
patient situation and just keep asking me as a policeman, or and now like in the court, I will not be happy under these
Yeah.
investigations, right?
Yep. Yep.
So two important things here, three important things. One, you shouldn't really keep asking a lot. You
Yep.
need to be giver, the more than taker.
Yes.
Explain more.
Yep.
Try to offer more investigations to be done.
Yes.
Offer more options. You're gonna do in the I may for this case. You
Yes.
may give a differential diagnosis of the case. If there's one condition you think about it, you can talk about it, and then you can even give one more differential diagnosis based on this case, right?
Yes.
And
Yeah.
then candidates actually got really very confused in this type of cases.
Yeah.
And
It's
then should I talk about the treatment or not? Should I manage? I would say yes, especially if the patient actually has any concern. So in this case, you must address the concern nicely. Don't say it is information gathering cluster. It's not right to address patient concern. Talk about the management of treatment. If the patient has a concern, you must address it, even if it's related to diagnosis part or management or treatment part. What do you
Yep.
think about this, Jenny?
I think that's sensible. From my vast experience with dentists, I think that's really sensible. Okay.
Yes, great then.
Yep. Terrific.
Okay, let's move on.
Oh, okay. That's the first cluster. Good. All right. Beginning cluster 2 or 3. Now, you may reintroduce yourself. This is the Osce thing. So, although we've had this conversation many times with candidates, and I've said, you've already done that in cluster 1. But talking with Dr. Adam today, we said, okay, they need to reintroduce themselves because they're in an exam situation. So you're going to be in an exam situation. So yes, reintroduce yourself, of course. Now notice the patient's position, and I've had a lot of conversation with candidates over the time I've been with this about this. Now, make sure they're comfortable. You want to re-engage with them. So, is the patient lying down? Is the patient sitting up? Is the patient lying there with the dark glasses on? How are you going to talk to them about the next bit? Do they need to sit up? Now, to re-engage with cluster 2, cluster 3, I think, again, the quickest way to do it is to say, how are you feeling now? And I've kind of brought this into the situations I've been talking about because when I get anesthetic injected into my mouth, it makes me shaky, and that's my physical reaction to it. So they might say that they're not feeling very well. They might say, look, I'm just really worried about time now. They might say, I've got to go and pick up the kids in half an hour. Is this going to be finished? Etc., etc. So just re-engage, and I think that's the quickest way to do it. How do you feel about that, Dr. Adam?
I totally agree about this point, and I think by this way you nicely can engage the patient in your role play. Definitely, I agree in this.
Right, good, good, good. Yeah, because that's just what I've found. All right, so then you move into what you've discovered in your preliminary examinations. Um, the
Sorry
treat.
for the for interruption as well here, Jenny. Okay,
I beg your
you know
pardon?
what is sorry for this. Do you know what is the most important thing in cluster 2 and 3?
Yep. What?
Is actually to discuss about the findings.
Yes. Yes.
Findings, because I always like the candidates when they start with findings. For
Yep.
example, like this way. I like always start this way. I say, okay, Mister. For example, like if say, um, I would say Jenny. Maybe your first name, Jenny. Okay.
Yep.
Would you mind saying Jenny? Jenny's okay, right? So Jenny, right? So Jenny, I know. Look, Jenny, I have already taken some photos for you. And by the way, I'm Dr. Adam. I just introduced myself earlier, but if you don't mind, if at any stage you want to call me Adam, is fine. Okay.
Yep.
So Jenny, I took some photos for you here, and
Thank
some
you.
X-rays. Would you mind me to go through them together, or should I discuss any points that you may concern you in the beginning? Which one would you like? Tell me.
Well, I can see the photos, but I don't understand about what I'm looking at. Can you tell me what you can see here?
Definitely. Now let's get closer to this X-ray. Would you mind? Because definitely we'll be sitting down in the exam, right? Would you mind if I stand up and then I show you what exactly I'm looking at?
That'd be great.
Okay, and then guys, you stand up and then look at the screen down there and then explain what you see. So in this way, you actually have engaged the patient in your play. Don't do things on your own, just only in your own. You must share with the patient the things you need to do for the next step,
Yeah.
right?
Yeah.
So
And
the
this is,
point, did you notice here, Jenny, that what I did is I give the patient choice to
yes.
choose,
Yes.
right? Would you
Yes.
like me to explain things to you, or would you like to ask me question first?
Yeah.
Which one do you like,
Well,
right?
no, I think that's great. And look, that brings up another thing, which I've just written down here too. Um, if there's a visual aid in the case that you're presented with or the cases, please use it because something visual is really, really important in understanding. So use it.
And use
And
draws as well. Yeah, they may draw sometimes even.
oh,
It's
yeah,
very
yeah.
good to draw.
And I've also had a candidate or two use, I don't know how they did it, but they used their hand. They used their hand and their fingers to to um, to show different parts of the tooth. I'm not sure how they did it, but it was really, at the time, it was really very good. And the other thing, which is going to come up later in our discussion, is that if you can involve the patient, would you like to know about what I found, what I found and so on. But quite really, it's a team effort. So the dentist can do so much, but there's stuff that the patient has to do as well. So it's a team effort. And you do it together.
Yep.
Okay. So, if you've taken out a tooth and the patient does not follow the instructions for the post extraction care, and they come back and they've got dry socket, well, if they've gone to a party and drunk half a bottle of wine, well, of course it's not going to work. So, you know, that's the patient has to be responsible as well. All right. Treatment options, explain in order. So try not to jump around with that. First, I'm going to do this, then I'm going to do this. I'd like to take an x-ray or x-rays, this kind of x-ray, and so on. There's more conversation, I think, in clusters 2 and 3 in this regard. There'll be more questions, there'll be more concerns. Do you want to talk about that, Dr. Adam?
Yes, Jenny, please. So, treatment options part.
Yep,
I would recommend if you go with any treatment options, it should be directed mainly toward the patient's concern
yep,
and the patient expectation. There's
yes.
something very important. I shouldn't go randomly just to list down all the treatment options. That's going to be a waste of time because Google does the same. Am I right, Jenny?
Mm,
Yes, it's what I'm saying is if you go on right now and ask, for example, Google right now, I have got one of my tooth removed. How can I replace this? You will find Google gonna list not less than 10 options. So
yes,
what's the difference between you as a dentist and Google? The difference is you listen to the patient carefully, you understand the patient nature, see the patient address. Maybe the patient tells you, I only want fixed restoration, fixed on replacement. I don't want removable. So in this case, direct your option toward the fixed part only.
yep,
So they may say, I care about the price, I care about the cost. Give
yes,
me just affordable option. So in this case, you need to list whatever affordable and conservative to the patient. Not just only go in there and just give every single treatment option. That's not right.
yep, yep, that's right. I think so.
Okay.
Yep,
And also concerns, always try to encourage the patient to ask. Don't be scared. The candidate they think. If they just going to keep talking the whole 10 minutes, they will cover all the points and the patients will love them. This is completely different, completely wrong.
yep,
When you encourage the patient to talk and ask questions, he will feel that the role play is more interesting,
Yep.
right?
Yeah.
And then in this case, they will like you more.
Well, it's not a matter of whether they like you or not, is it? It's a
It is,
matter of whether you're doing your job properly.
yes, but they should build up rapport. Like, okay, why, okay, Jenny, what
Yep.
does make you to go to your dentist right now, not the next door dentist? Because you
Me?
like him. Yes, because
Oh
you like
yeah,
him.
yeah, yeah, yeah. And my dentist, he's a terrific dentist.
You
And
see?
what I really like about him too is that when when he gets going and I can't talk, um, he'll tell me what he's doing. He'll tell me what he's doing. I don't know if everybody likes that, but he'll say, look, this is going to take a couple of minutes. We're nearly there. I just want you to do this for now. And this is what I'm going to do. It won't take too long, etc., etc., etc. But he has told me, and he's done some, fairly extensive work for me over a few years. And I'm always aware of what he's doing because he tells me. And even when he was doing some work, I had an implant done, a bone graft and so on. That was a specialist. But when he had to come to fit it, he actually showed me, this is what I'm going to do today. And he had typed out every step, and it was quite an extensive series of things. So I was aware of what had to happen, and I was confident that it was going to be done properly, and it has been done properly. So, it's there will be all kinds of questions and concerns, but please listen and respond. Yeah.
I agree, and they should listen actually, and then they should respond. Um, they should accordingly respond accordingly,
Yes,
not just only what they want to say.
that's it. That's it.
Okay, and yes, by the way, guys, sorry for this. We guys, do you know, guys, that please, guys, say congratulations. Sorry, Jenny, for interruption. I just need to announce for something because it's 8 o'clock right now. But please, um, Jenny, just give me maybe a couple
Yeah.
of minutes on, okay?
Yeah. Sure.
Thank
Sure.
you.
Sure. Sure. Sure.
So, okay, so guys, actually, I would love to congratulate everyone who has passed the exam yesterday. I believe we have about 9 champions. And guys, everyone of here right now, we have up to 200 champions right now on Facebook. And then even crossing 200 on Facebook and Zoom and YouTube. Okay. So, guys, I know every one of you here today because you want to pass the exam. And it's a great feeling, actually, when you pass the exam. So, please, guys, congratulate everyone has passed the exam yesterday. We have 9 champions. Never, I would say, no one. I wouldn't say the academy because they're our candidates. They're our champions. They're great dentists. They actually the leaders. Please, guys, say congratulations to them. Everyone who has passed yesterday. And
Uh,
we have one of them today, Jenny. She is Dr. Mankwell. She's going actually to help everyone here. How did she pass part one and part two? What are the most important, right? Things they actually should follow or they should do to pass like her. She's going. I think she should be here right now. Give me 1 second
sure.
to see where is she because I believe she'll be here on Zoom right now. Yeah, she's there right now. Okay, let me just make you co-host, Dr. Manko. Okay, Dr. Manko, are you able to talk right now?
Hello, doctor.
Hi, Dr. Manko. Congratulations to you.
Thank you so much, doctor.
Thank you very much. I'm very proud of you. I believe Jenny. Jenny, are you proud of every champion who passed the exam, Jenny?
Look, I really am. I really am. It just, yeah, I feel very happy when I find that one of the candidates that I've been working with, or many of them, have been successful. It's just wonderful. It's just wonderful.
Today, actually, I was in the academy, and then I had the candidates around me, and then they knew that there are 9 champions pass the exam, and then one of the candidates, I don't know she hears me or not. She said, "Once I knew there are 9 people passed, and generally when I see people passed, I cry." And she
Yeah,
said, "I really cried for them," and she's still a candidate. She's champion.
yeah, Yeah, that's lovely. That's lovely.
So definitely, we understand about this. Even me, and when I see these people, they pass because I've been through their own journey. I start with them. Dr.
Yes,
Michael, she was my part one candidate, and she's part two. Am I right, Dr. Michael?
Yes, doctor. Yes, I am.
And the nine champions, they passed the exam yesterday. They all my part one, part two. So I understand about them. I understand about how hard the journey was. But once they pass the exam, they
yeah.
feel completely different. I believe Dr. Michael feels right now that she is a queen today. Am I right?
Yeah, it's unbelievable, I would say. You've been waiting for this day and you didn't know that it is going to be today. So yesterday when I got result, I made my husband repeat 3 times that did I pass? And he literally said 3 times, yes, you did pass. I'm like, take the screenshot and send it to me because I was working. So that was unbelievable. I still can't, like, I'm just opening my ADC portal and looking that, complete sign for which I was wishing for so quite long. So yes, it is.
Well
Yes,
done.
I know you think. You see, Jenny, look at her voice tone right now. I
Mm.
have met Dr. Michael many
Yeah.
times, right?
Yeah, well
Yes.
done.
Yes.
Yes, I love to hear this happiness in her
Yeah,
tone,
yeah, yeah, me
Yes.
too.
He
right?
saw me when I was overthinking, when I was thinking about my family a lot, and like I was trembling, and every time when I failed, and I went there, and he was like, "It's just your confidence," and really, it was just the confidence you want to have when you are there.
Yeah,
So I followed that. I really know that whenever I failed, I just wait for the day when I wanted to meet. And everybody says that it's very difficult to meet him, but I don't know. It was my luck that whenever I wanted to meet him, he's there. And I just sit there, he gets some time, everybody's waiting that I am having a chat with him. And he's always like that, you know, you can, it's just the confidence. And he made me met Dr. Mary, and she told me that you can do it. It's just the confidence.
yeah.
And here I am.
And here
I'm
you are.
very proud. I'm very proud. Jenny, do you think I'm a busy person, Jenny?
I beg your pardon?
Do you think so? Do you think I'm a busy person?
Is he?
No,
No, no.
you
What do
are,
you think, Jenny?
but I think he knows. Usually, people always say to me that he won't reply. I still remember that with my first attempt, I had some conversation with someone about post-operative infection, and they just, you know, derailed my all concept. I messaged him on Messenger, and I think after 1 hour, I got reply. And
Yeah.
he just literally said to me that, "Why are you listening to others if you have concept?" And I'm like, "Oh, they passed, and they're saying this and that." He's like, "Why are you listening to them?" And I still remember. Okay, I'm like, okay, I should not listen. I should not.
You need to trust yourself too. You need to
Um,
trust yourself.
I think Academy, and I would say my study partner. Um, I'm just waiting for his result, then when he's going to pass. But I think you need some people around you who trust you more than you,
Yes.
because sometimes your trust goes down because of lots of happening around you. You
Yes,
need
true.
something, a motivation, I would say, and you get here.
Yeah, yeah. You need support.
Yes,
Everybody needs support, Dr. Mancala.
yes.
Everybody needs support. And I think with WDA, you've got it. I
Okay,
think you've got it.
Jenny, you won't remember, but Dr. Bito told me that have a role play with you. And I did the role play good, but told me that why are you using okay a lot of time? Okay and
Remember?
hum.
I
Yes,
remember.
yeah. And till now, whenever I use okay more than 2 times, I just remember your words. Don't say okay.
I remember you. That's really funny. Okay, okay,
I know.
okay,
I think now,
okay.
Jenny. Now you start to say okay a lot now, Jenny. Right? You start to say okay a lot now, Jenny.
Oh, that's lovely.
Okay.
That is really lovely.
Okay, Jenny, look, I think Jenny, we need to go. So, Dr. Michael, I think
Yeah,
we have still maybe few slides to go through.
yeah,
Let's
sure.
Jenny go through this slide
Yes,
on these
Yes.
jargons because a lot of the
Let's
candidates they
have a
have
look
issues
at
with
this.
jargons.
Let's have
And
a
yes,
look
then
at this.
yes, and then maybe next time we
yes.
going to go through the rest of the slides and we can do a proper role play with a proper case. How does it
Sure.
sound to you, Jenny?
Yeah, that sounds fine. That
Yep.
sounds fine.
That is great then. Okay, so
Okay.
Jenny, yes, let's just do this slides for today.
This is the last one.
This is the
Okay.
last one for today, and then
Okay.
we're going to have
Okay.
Dr. S, and then we're gonna have Dr. Mankul after this. Okay.
Okay,
Well,
Dr. Adam Bedo, and okay, Dr. Mankawa Kaur. Okay.
it's a very big deal when you hear this doctor word. Like it's like when someone say doctor, you get that little smile on your face, and you know that you've achieved that.
I can hear your happiness in your voice. It's lovely. It's just lovely. So congratulations, and
Thank you
everybody
so
else
much.
who passed yesterday. It's
Yeah.
gorgeous. All right, let's have a look at this. All right, and then because everybody has probably got enough information tonight, and that was a lovely bit of information there. So, avoiding dental jargon. Now, there are lots of things that I've heard over the last little time that the patient's not going to understand. So we've got avoid using formal dental terms unless need for the OSCE. And of course, I think you do have to say those things, but please, please, then say something like, look, this sounds a really complicated series of words, but this is actually what it means. All right. Dr. Adam, what do you think about that with the dental terms for OSCE?
Not necessarily all the time to actually use jargons, which
Yep.
is dental terms, unless they really provide diagnosis. I would say when they
Yep.
provide specific type of diagnosis,
Yep.
so we may need to use it because patients sometimes would love to check on this diagnosis by themselves and Google and search on it.
Oh,
Yes, definitely. Like if someone say, "Okay, what do you have right now?" Is we want to give you the best material for your crown or a cap material. Which is the best cap material? For example, zirconia. What is zirconia? Can you give me the spelling of this word? It is this spelling. Okay, I'm going to search for it. Is it zirconia good material or not? So this is the way they normally like us to use jargons
I
when we
see.
give them specific type of material or specific diagnosis.
Right.
However, you're right. If you're
Yeah.
gonna give them any jargons, you must explain it in simple terms, the layman language, very easy language.
Yeah.
Explain what is this.
Yeah.
I'm sorry for this. And by the way, I normally, when I say before I say the jargons, normally I explain it first. What
Yes.
is this, and then say it.
Yes. Yeah. No, that's good. Let's keep going. So, look, another thing that I've got here is, and I'm just going to put this in here now. I hear all the time, and I'm sure the OSCE examiners do too. How do you maintain your oral hygiene? Now, where on earth that comes from, I don't know. How do you look after your teeth?
Books. It comes from books
Ah,
because in books, actually, the word oral has been given to us as dentists.
oral's
But
fine.
yes,
I'm
but the
not worried
patients
about
does
oral.
understand what is oral most of the time.
I'm not worried about oral, but how do you maintain your oral hygiene? How do you clean your teeth? How do you look after your teeth? Is a lot more natural.
Yes.
So I would just encourage you to say it a little more simply, please. That'd be good. And some examples that might need explaining would be topical comes up every now and again. And, I know now what some of these things mean. But topical is that it goes onto the site directly, whatever it might be. Communication into the sinus, small hole between the roof of the mouth and the sinus. I think we all understand sinus. Pocket depth, pockets. a patient would ask you to explain that. They would not know what that means. So a way around that would be if you are measuring pocket depths and you're saying the measurements to the dental assistant, you might say, look, you might have heard me saying some numbers to the dental assistant. What I'm doing is measuring, etc., etc. And then you say, well, that's pocket depths. Bite wings is another one. So I'm sure that you'll think of many others. Just think about the language that you use to your patient and think, all right, does that patient understand it? So yes, sinus, we know what sinus is, we know what oral is, but there are other things that you would use. Communication into the sinus. Furthermore here, avoid frightening phrases. I'm talking a lot, mixing up.
You okay? Actually, they actually want to hear you, Jenny. They want us. I believe now they have pen and paper. Write down what you say. They say, for example, instead say communication, make say a whole. They write down all the stuff now. I'm
small
sure.
hole, just a small hole.
Yes.
So, and you're going to talk about, what happens then. So avoid frightening your patients, please. The gum is dead, I heard last week. And I think there's a kinder way to say that. Look, we've got that here. This area isn't healthy right now, but we can treat it. All right.
Sorry for interruption. You reminded me of something right now.
Yep.
Okay. I was actually, look, this has happened to me personally, Jenny.
All right.
Yes. I remember my first one, I would say the first years in my life in Australia, I used to be in a dentist. I mean, like, start to be a dentist. I use the word dead. I say to the patient, the tooth is dead. You know what has happened? The patient said, "Oh, do you mean like we're gonna bury the tooth?" I said, "Okay, sorry." They bury the tooth, and then said,
No.
"Okay, that's it."
No, we're just going to take it out and then
Yeah,
throw it.
yeah, but you see, and believe me, it has happened even with me with dry socket. One time, and was honest. Like this was even very serious conversation between me and to the patient. I was
Yep.
telling him, "You have a dry socket." He said, "But I drink enough water every day, doctor." I was
Oh,
okay.
look, I'll tell you a
Okay.
story. I'll tell you a story too. Where I go and have some other medical treatment, there is a dentist there, and quite often the door is open, and he's a very talkative dentist. And there was an old lady in there, and her son, who was looking slightly feral, was there waiting, and he said, he said something about he said, oh God, he said, can I have that tooth replaced?
Hmm.
And the dentist said, well, if you're smoking, it won't be successful. And he said, it'll just fall out again or something like that. And he said, well, can't you just make a bigger hole and stick it in?
Yes, true. That's
Honestly,
really
I
hold
nearly,
to
I
hold the
nearly fell
tooth.
off the
Yes,
chair
they do.
laughing.
Yeah.
But then I had to go and do whatever I had
Patients
to do.
sometimes patient expectation is very lovely. Honestly,
It
when
was
the
really
patient have their own
funny.
expectation, they really is.
It was really funny. Okay, but just towards the end here, avoid saying something is malignant or cancerous. You've got to be kinder than that. Instead, explain that you found something that needs further investigation and will be checked by the appropriate specialist. And I think that is, you've got to be very careful about that situation. You might find something that you just know that there's a cancer there, but don't frighten the patient. Look, I'm concerned about this. You're telling me that it's been there for more than 2 weeks or more than 3 weeks. I would like to refer you to a specialist who will have the more experience, more training in this, because I think we should investigate this. But don't just be careful, because you don't want to frighten them.
That's true.
Yep.
By the way, let me just add something here, please, Jenny.
Yes.
When we actually say the specialist, we need to specify what is the specialty. So
Right.
yes, because it's something very important and recommended as well. And
Yes.
explain the justification behind it. Like this is three things here must be done. One, give the specialty. For example, you can say the braces dentist, which is orthodontist. Okay.
Yes.
Don't say just only because candidates say, I'm going to refer to specialists. Which is specialist then? They straight
Which
away,
one? Yep.
yes, straight
Yep.
away. They go
Yep.
worried the patient. They ask which. Okay,
Yep.
I mean the price is special, the one who's going to straighten your teeth, for example.
Yep.
So it's very important to give the specialty.
Yep.
Number two, to recommend, I recommend or suggest this. Number three is to justify why. And
Yep.
sometimes you actually need to know, you need to tell what the specialist is going to do as well. If you're really
Yes.
going to refer.
Yes.
These are very important things, I would say.
I think that's terrific. I've just been writing that down. Okay. Oh,
Okay, look, Jenny, I think that's a good
better.
time.
I'm exhausted.
You see, no, yeah, I need to keep going there. You see, you please
Yeah,
have a rest. That was great, Jenny. Thank
that
you.
was terrific. And look, I have learned a lot tonight too. So look, thank you everybody. And thank you, Dr. Beto, for allowing me to do this and working with me on this. I think it has enabled me to focus in on some things in the work that I'm doing with the candidates. And that's terrific. That's terrific. I've learned a lot tonight myself. So look, thank you so much. It's been great.
Thank you very much,
Great.
Jenny. We learned from you a lot as well,
Well,
right? And all the candidates really appreciate your help, and you work for every one of them.
oh, well, I try. I try.
I know you do.
I always feel it's a privilege to do this work. So thank you
Thank
very
you very much.
much, and good
Thank
luck,
you.
everybody, in all your preparations.
Thank you very much, Jenny. Then, thank you.
All
Speak to
right,
you
Dr.
later. Then,
Adam.
talk to you soon.
Okay,
Thank you very much.
okay. Cheerio. Bye now.
Thank you. Bye, bye, bye.
Bye now. Bye now.
Thank you. Okay, guys. We have. Okay, guys. Thanks very much, Jenny, guys, and please,
Okay.
guys, no problem. Thank you, Jenny.
Cheerio.
Thank you. Bye, bye. Okay, guys. So actually, we had Jenny, guys, and then I believe Jenny she was the best person ever to actually, guys, go through all these points. Being she's teaching since long time with experience, a great experience, and my actually the feedback I got from the candidates that she is very lovely, she is very helpful, she takes things very slowly with the candidates, explain things in details, and that's what I love about her. And today as well, we got Dr. Mankel. Hi, Dr. Mankel. How are you going?
Yes, Dr. Bidu.
Look, I'm very proud of you. I'm very happy and proud. You cannot imagine how much I'm happy and proud of you.
Thank you so much, Dr. Bidu.
You may know why, right? You
I
may
know.
know, yes, you know me because,
I know.
yes, because once I see you, Dr. Mankel, once I knew that you passed, I was really very, very happy.
Yes.
And you know what? The whole journey,
Yeah.
the whole, I would say, um, story between me and you,
Yeah. Yes.
it just came running in front of my eyes, just to think about like how was your journey from part one and then going through part two and all this stuff. So, okay, now it's your time. I would like you to talk to the candidate the way you would like to talk. Give them advice, give them recommendation, try to tell them how is the journey and all this stuff. Everyone is waiting for you to listen from you.
I hope I can help them. Um,
You will be definitely. You will be the best to help.
all right.
I will be here next to you if you need anything. I sit around. Okay.
All right, doctor.
Yes.
So I hope I can help you anyway. If someone wants to ask question, they can. But I'll just let you know that um, I never thought of like coming Australia. I was thinking of doing my masters back in India, but I think God has plans. So my journey started quite a long back. I would say in 2020, I got, I would say, arranged
or engage, I would say. And then my focus was to get this ADC exam done. I didn't know even a single thing about it, that what is it and how it's going to be done. Once I know that, okay, I had someone here who is a dentist, they just told me, okay, it's easy, you need to do this and that. I'm like, okay, but I'm a person who needs guidance. So I start searching on Facebook and I got with this academy. I texted them and I still remember that I was sitting on the floor when I got a call from them, and I was like, okay, this is what it is and I don't know what is it, how to do it. And they just told me each step, like how to do initial assessment and then how to apply for your written examination. So yes, uh, I gave my first attempt in 2022. To be frank, I'll just let you know that I was preparing. I was very particular about attending all the classes, but I failed pretty badly in my first attempt, and my confidence was zero. So I was like, okay, what is it? I do remember that on that day, I didn't know that Dr. Adam Biro is the one who arranged everything. So I just made a call to him. I didn't know that that like people used to now say that he's busy and everything, but I never encountered that thing that he's busy. I called him, and after 1 hour, I got a call. He's like, "What happened?" I'm like, "This is what happened. I failed this and that." And he said, "All right, take a deep breath and tell me what happened." I'm like, I don't know. I went there and I didn't even understand what the question was and all that. He told me that now you had the experience, now you need to do it again. But I was like, I'm terrified. And I'm a person who overthinks a lot. A lot. A lot means like, if something happened in front of me, I'll be like making a story, like what is going to happen with me and what and all that. But he just told me that start again. So it is tough. I'm not going to say that it's easy, because every time you start, you get different kind of scenarios in front of you. Your situation will be different, everything will be different, but I think it's just in your brain that if you want to do something, you will do it, and there will be someone with you which will be there, which will help you out. I came Australia in 2023. um, I started preparation. I got someone from the academy, and I only did, I would say, just the revision of those questions with them. But I do remember that my husband sleeps, and I'm just sitting on the floor revising those questions. And I didn't even know that how much hours I was sleeping and what. And because I do remember that when I was like in my bachelor's degree, I used to do this, like my mom always says sleep and all that, but I was like, no, I need to get this thing done. And I think that's what you need. It's not about that what type of brain level you have, I would say, like how much information you have and all that. No, it just matters that how, like on each day, are you going to be there? Like if you know that you don't know anything, but you're still there, that okay, I'm going to do this. That's what matter. And I think the day I got my written examination result, I was like, okay, I did this. Okay, I achieved this. But I didn't even celebrate. I'm like, okay, now the next task is my practical examination. I was asking everyone what to do and all that. 2023, I went to academy. I never thought of like joining any other academy. Lots of people guide you, I would say. I'm not saying that this academy, but it's just your gut, that what kind of teaching you need and what kind of, I would say, you're looking for. So in 2024, I gave my first attempt. And I do remember that when I went for my technicals, everybody in my batch, they were saying that you got a very good hand in technicals and everything. But I never trusted myself. I don't know. But the friends I got in this journey, they always trusted me. And Dr. Bido, Dr. Mansi, she's the one, like, she's like, you know it, you can do it. Why are you thinking about it? But unfortunately, in my first attempt, my loops didn't work. And on the exam day, I was adjusting them, it didn't work. And I failed pretty badly in my technicals. My confidence was zero. Uh, I went back to academy and they were amazed. They were like, okay. But they told me that it's okay. lot of things happen. So I was they just let me know that what happened with other people, like how they just failed because of one thing. So they're like, that's okay, that you have a reason that you failed something. I'm like, okay. They pushed me, they made me do mock. The mock is very, very important. Doing mocks, you will get tired. uh, I got some suggestions from Dr. Ray. I wanted to say something. She's my senior, like back in India. When I was doing my internship, she was doing her studies, and she helped me. And because of her, I topped my endo department, whatever it is. So she told when she just told me that you need to be particular about the mocks. Like it is really like to eat and think about ADC. It's like just wake up, do your OSCEs, just little time for your breakfast, go for your technical set, need to be proper, like you need to be like sitting over there for an hour, because your body should know that you can sit for 3 or 4 hours. I'm a person who's very impatient. I just wanted to get things done in a one go, but I've controlled that with my patients. And then afterward I do the OSCEs. That's how I did my second attempt, but I failed just because of my diagnosis cluster. So, but so everybody gave me that you did well. Like you came a very like failing that in first attempt and then passing in second. A lot of stations was like okay, but I was heartbroken. I'm like okay, now another struggle. Like I need to go through this thing again, that trauma and everything. Um, yes, and the third time I got a very good study partner. I would say he's the person who told me that if you are going through this exam, you don't need to be stressed every time. You need to be like balanced. Because if you're not going to give time to yourself, you won't be like, recovering to get back to those things which you are doing wrong. And yes, we were pretty consistent, like doing role plays in the morning, waking up around 5. If someone wants to sleep, other is going to give them call. We do one set, take rest, technical. In the evening, we meet again, we do OSCEs, then skilled OSCEs, and then we sleep. That's how we did. Hello?
Yeah, I think I still hear you. I still hear you. You're audible, yes.
Yeah. I don't know what else to say, Dr. Vito, because if somebody wants to ask me, they can, but I can't even express that. Like, there are some personal things as well, which made me question myself every day that am I capable or I'm not going to do this? But I think it's just your willpower that if you wanted to achieve something, you need to stop other things for some time. That, okay, just wait, let me go through this thing. And I think you need support. Every time I lose confidence, there are someone from the academy who pushes me, who asks me that, are you doing right? If I'm saying that I'm doubting myself, they will tell me that, okay, everybody doubt themselves. Everybody, even the people who pass. And that's right. I was doubtful till I got the results that, oh, what if this goes wrong? What if this goes wrong? But yes, you never know what happens.
Yes, I agree in this, Doctor, and tell you something as well. Look, we actually in Academy, when we see you guys, we understand who you are. Based on the experience I used to get with the candidates, I can tell definitely everyone is different. In your circumstances, this happened for part one, part two.
Yeah.
In part one, I see the candidate, they have some issues in some points, but it's not the same issue, by the way. What I'm saying is, you're like for you, you really needed confidence. So,
Yeah.
what has missed you, or what did you miss, is actually confidence only, I would say. And the rest of the people, some of them, they may miss clinical skills, they may miss communication skills.
Yeah.
So everyone is different. They are not the same. I haven't seen most of the candidates the same.
Yeah.
Now you, when I used to talk to you, I found you always overthinking,
Yeah,
right?
every time. Like you listen me for 5 minutes and then you'll be like, okay, Mankaval, you're thinking a lot. You should not think. You just think about this. You can do it. And I'm like, okay.
Yes. There are other candidates actually the issue not overthinking. The issue is they don't practice.
Yeah.
So I tell them you need to practice. And so yes, and then if they listen to me, they actually get it right, and then they will be fine.
Actually, that's very right, Dr. Bido. You need someone in your life who are just straight to you. That's where you are doing wrong. If you are going to get some sugar coating person that who are not going to tell you that where you are wrong, you're not going to get through this.
I agree. And the smart people, they really take it seriously,
Yeah.
and they know when we talk for their own benefit. And other people, they may get upset. However, all the time when I say it, I be very polite. Because
I
definitely, I don't
I
want to hurt
remember
anyone.
I was telling you that please root to me. I don't know. I just want you to be like, tell me where I'm wrong. You like, I can't do that. I'm like, you need to do this.
Yeah, definitely. It's always my happiness to help you for the things you can get improved.
Yeah.
But definitely, I cannot be rude, right?
Yeah.
Yes. And that's exactly what I'm saying. The good thing is you actually been willing to listen. And you told me, I remember told me something. I said, I'm here only to listen to you. I'm not going to listen to anyone except you.
Yeah. Yep.
Right?
Yes.
And this trust you put on me, it made me actually to look after you. And that is exactly what happens.
That.
Because yes, because actually trusting me, definitely I will not disappoint you.
Yep. I do
Right?
remember in my second time, I think Dr. Rajneesh, he got into the teaching part, and you made up like you made him call me to ask that what went wrong, and he was asking me that okay what went wrong, and he then just like he just said that okay this is what you're doing wrong. You don't need a proper script to say. You need to make them as a patient, like treat them as a patient. They should not be script in that way. And I think that thing just did.
Yes, and this is the things actually what has happened at that time, I remember now. What
Yeah.
has happened at that time is because Dr. Raj has passed from his third attempt.
Hmm.
So I knew he's gonna be the best person to explain to you how is it hard in the first attempt if you cannot pass, but then how he has felt it the first the second attempt, and then he may lost his confidence, but because I believed in him,
Yeah.
I know how good he is because definitely I know Raj very well. For you know what, Raj was in the same batch like Dr. Mansi. So Dr. Raj and Dr. Mansi,
Oh.
both of them they be in the same batch. I'm telling you this and this to everyone. Dr. Raj was amazing at that batch. I would say he has the best handwork ever than anyone else at that batch. And everyone knew this. And he's supposed to pass from the first attempt. But that's why every time he couldn't pass, he had bad luck. He couldn't pass Indo 4-6, and it was the first time. And then this is happening. And then at that time, actually, I told him, look, it's not because you are bad. It's just your bad luck. Believe me, you're going to pass.
Yeah.
Just do it. And then once he passed, he remember I said, I'm not saying this just for anyone. I'm saying it because I know how good is he. I know how good you are as well, right? So this is what I'm saying. That's why I spoke to him. I said, Raj, please talk to Dr. Manko because she's in
Mhm.
the same situation like you right now. I believe in her. She's going to pass. But I need you to talk to her and explain her about your attempts. You will be the best person to explain to her, and then she will understand your circumstances better, and then she will actually match her situations with your situation.
Yeah. That's very correct. Because once you know someone who've been through that path, they can understand you more, and you can also understand that okay, that's okay. You can do it.
Yes, I agree in this part. And that's why I'm telling all the candidates, I believe in the candidates. I believe in my champions because I've seen how hard worker they are. And in academy, if you see the academy since long time, right?
Oh, yes,
In,
yes, doctor.
in academy, we are lucky. We have always the best dentists ever.
Yep.
We are lucky about this because we see them. They're really very smart. They're really very good. We really help them, and then they listen and then they study. And then that's why they pass the exam. So that I'm saying, because I knew about this, I knew about the fact, I knew the fact that everyone going to pass as long as they doing the right work, the good work, right? And then we keep telling them, please don't stress yourself up a lot because the stress is your enemy in
Yeah.
this process. If
Yeah.
you doubt yourself and if you're going to be stressed all the time, believe me, you won't be able to pass the exam,
Yeah. That's very correct, doctor.
right? So you agree in this. After, before you pass the exam, you be in this situation. Now, after you pass the exam, you see this way, right? You see this
Yes,
very clear right
because
now.
this time I was having this thing in my mind that once I entered the room, stress is not going to be there. It's just my words and my conversation with the patient. Whatever it is, just do that. And I think that works. I was doing, a kind of deep breaths I was taking. I was walking in that corridor to, relax myself that no, stress is going to complicate each and everything. If you know things, you need to tell them. If I'm going to stress, oh, what if they ask and all that, it's going to fumble up. You are going to fumble, and everything will be finished.
I agree on this. And there's the same things I actually discussed with a candidate today in academy. I
Yeah.
was telling them the same things. Even I was explaining to them about my experience, my first experience too,
Yeah.
right? So I agree in this totally. Everyone, either in part one or part two, I'm telling you what is your biggest enemy in this process is stress.
Yes, doctor. That is. And I would say overthinking as well.
Yeah, you overthink it. You used to overthink a lot, Doctor Man. A lot in points. When you explain to me about your role plays or explain to you
Yeah.
about like the things you've been really going through deep points, which I said you don't need it,
Yes. Yes, doctor.
right? Yes. So, but this is very true.
Yeah.
I have seen you really doing great. You've been really very. You've been. You know what the things really. You're very enthusiastic. You're very dedicated. Like the way that you come to the academy multiple times to meet me,
Yep.
to discuss with me, right? And then you take everything seriously and
Yep.
you try it again. That was really awesome. Like this is amazing. Actually, that's why That's why I'm telling you. I was very happy to help you because I see how much dedication you put.
Thank you so much, doctor.
No problem, Dr. Michael, as well. You really deserve it, and I'm very happy for you. I'm very
Thank
happy for you. Okay,
you.
there are a little bit of questions here right now.
Yes, sure, doctor.
Okay, so the question from part one and part two both.
Yeah.
Okay, part two is Dr. I need to ask this question. Please, guys, if you have any question, you ask now, please. We can take some of your questions now.
Yeah, because I can't see questions
Yeah,
here.
it's on Facebook. I will read them for you. Okay.
Oh, okay, okay,
No problem.
okay. Facebook.
Could you tell how you prepare for part two and how you balance technicals and OSCEs?
All right. So that's very good question. Why? Because we just sometimes we think I need to get better in OSCEs and we just leave technical, but that's not. In a day, you need to balance it. The way I told you that, okay, I'll just give you an example that 2 months were left for my exam, and I'm like, okay, I need to do it, do get better. It's not about doing role play. It's about getting the concept first and how you're going to present it. That should be in your brain, not on a paper. Once you know that how you are going to communicate with that person, you will be good. Whatever, if they are going to stop you in between, you know how to get back to the point where you want, right? That thing. And if you're talking about the technical, see, you have 6 days, do 4 mocks in a week. Mocks mean that you need to do each task, because if you think that, oh, I am good in this task, I'll manage in the exam. No, in exam you don't get 6 hours, you get 5 hours. And if you get a set which is like longer, then you'll be gone. That's what I think. So my motive, like whenever I do technical, my target was to finish it in 4.5 hours. And if the task is bigger, see, I'll give you an example. If you have someone or you wanted to do role play with yourself, wake up early, do your role play like a set, give yourself some time, then from 9 to whatever the time you wanted to have, I would say 9 to 1, do your technical, take half an hour break, 1 to 2 hours technical assessment, then rest. Go for a walk, go for your meal prep and whatever you want to do, because life goes on. And then do oskis. That's what like I did my last month. You'll be like drained, like you are like that what I am doing, like you need day off, take a day off. That's what my study partner told me. We were like working as like this, but in a week we give ourselves 1 day where we do nothing. But still we do some things like rectifying our technicals or rectifying the mistakes which we did. That's what I can tell.
Yes, look, I totally agree on this. I always ask everyone they should they should care about their mental health as well. Mental health is something very important. They should take some break,
Yes.
and then they should relax a little, and then they should have, I would say, some gaps, like some windows.
Yes, Dr. Biro. Before I was not doing it, but this time I really had some time in a day. I did my OSCEs, I technical, and then I made some time like 2 to 3 hours I have in which I do my meal prep for morning, lunch, and my dinner. And then I go for a walk, come back, rest, and then get back. That was the routine.
Yes, I totally agree on this one. Dr. Wali just say something here right now. Sometimes, while preparing, my confidence goes so low. I'm not able to study properly. So, what do you think about this, doctor?
See, I do understand your confidence when sometimes you're doing and you're not doing it right, or something went wrong. Everything comes back, your failures, people who are doing well, and whatever your private life, everything comes, you know let that thoughts come. That's what I have learned. Let that thoughts come, because if you're going to stop them, they're not going to stop. They're going to be a burden on your brain. Let them come, let them bypass. You'll take, I think, 5 to 10 minutes to think about the worst scenario of this happened, that happened, and whatever. After it's gone, come back and do your stuff. That's how I was dealing. That okay, let it be. What if I fail? What if I that? Okay, fine. But then, okay, that's it. Brain did the job. Now you do your job. Get back to your things.
I agree in this. So now a question here. Can you tell us, if you remember, can you tell us more about how to prepare for part one? What do you think?
Okay, so part one is like, you need, if you're going with academy, you need to be like, just when we are in college and we attend classes, and then we make notes and then revise. That's what you need to do. Don't think about what you have learned. Just see what, when I was doing part one, I was not thinking that I am a dentist. I was thinking that I'm doing my master's. So whatever I'm learning is new, so that my brain get those things absorbed. And when you're like, just listen to them, that how to get, because it's a scenario based. Once you know the scenario, that questions you're just going to answer without reading the options. That's what I felt when I passed my exam. When I was sitting in the examination center, the question came, and I'm like, okay, this is what they're asking, and I was finding in the option, this is the answer. So you need, like, it's not like that you're not going to do hard work is going to be there. When your body start aching, your brain is shutting down, that I'm done with all the information, just stop. Just think that you are doing best. That is the stage you need to be reaching. That's what I can say.
I agree in this. That is great one. Okay, Dr. Simran asked question, how to do smart study and be sure we are completely prepared. Since there are a lot of stuff that we are not even aware that we have covered or not.
Is it about the part one or part two?
Yes, I think it's part one.
Okay.
You can give advice for both, part one, part two together.
See, basically, the thing is that you need to know each and everything. Okay. If you don't have time now, that you can't read those PDFs and everything, try to understand the scenario, that what it is saying and what they need. That is similar in the part 2. Everybody goes with the scenario, but the bold part itself says that this is what you need to talk about, and that's what they want to listen. Once you know, see, it's not about reading a lot of stuff. When you read a question and you want to understand, you will get some question marks and you will try to find those answers, and in that way you will learn those things, and your, I think your part of that will be completed.
Hmm. But she actually says as well that there's a lot of study to read and articles and stuff. What do you think about this?
See, the field in which we are, like, I'm I pass, but there is lots of things to read right now. That is the thing you need to do it. If you see, um if you didn't have a time, I would say get a partner, get a study partner who knows the information, because they will get a benefit of teaching you and you will get the benefit of knowing things. So that is a smart work. Like, help others and they will help you. That's what I've learned.
Okay. I agree on this definitely. So they need someone to help as well, right?
Yes, like, you need to find some people there. The first thing is you need to help someone. Once you are in that okay, I'm going to help someone, they will help you, and you will get a bond. That, because it's a journey which needs pressure, which needs everyone to support. So get a partner who will support you and you can support them till you reach that goal.
I totally agree in this part then. So they can help each other definitely. They can divide the job.
Yes, and
So
also you have this Telegram groups and everything. Uh, you can just ask a question. I think there will be million people in there, or tutors. They will answer your question. Ask silly to silly questions. If you shy, ask personally. I have done that.
that's very good. And that's a good idea as well. Okay. There's a question here as well. Doctor, please tell us. It's I think the same question we discussed right now.
Yeah.
So the question was, Doctor, please tell us about your study routine for part one.
Oh, the part 1. So it was very hectic. So I was in India and I usually remain in just one room. I only come out for my food. And in the morning, I just start reading those PDFs. By the afternoon, I'll be solving those questions. Then I will attend the class and then I rest. And then I start revising what I have had in the class. So, revising what you have learned from the class is very important, because your brain is not a something like which is, it's not a pen drive where you just record things and it will stay there. You need to revise it so that your brain cells know that you had that information, it's there, and when something comes, your brain will be like, this is the answer. it, it's all about uh, doing practice. More you practice, more you will grasp those things. There's nothing like intelligent, or I would say dumb. It's all about practice. Person who practice every day and be consistent gets through this.
Totally agree. Dr. Depti asked question. Congratulations, Dr. Manko. I want to ask you about how you started as a beginner, how you prepared the theory, and how you revised it.
Okay.
And what is your best advice? Best advice for first timers.
To see, whatever you are listening in the class, just write it down. Even a simple or single thing. Don't think that you're going to make a very good notes. I'm a person who never make a good notes. I'm like writing small, teeny tiny things on a corner of a paper. Just write it down, and then you're just going through, repeat each and everything, and then revise it with someone. Try to teach someone, or if you have nothing, don't just go and find someone, because I think it will be hard for you. Record yourself, do a video, like start a video and try to explain yourself, okay, this is this, and then once you just forget what is that, like, listen to that thing. What I usually do is I have lots of voice recording of mine. Whenever I feel like that some concept is not getting into my brain, I repeat that concept, or I'll record myself, and then I just keep hearing when I'm just walking, or I'm going for a walk, or whatever I'm doing, or I'm in the kitchen, I'm doing dishes. I'll just put my headphones and I'll just listen those concepts. It's just that, don't think it will be easy, but don't think that it is impossible. Don't listen to people that they are going to say, oh, ADC doesn't pass. If it's your time, if God has made you to do this, you will definitely clear this. That thing should be in your brain.
Yep, totally agree. Thanks so much for this. Dr. Manko, there's another question as well. The question here is about Dr. Oma asked question, just starting prep for part two. How to start preparation for OSCE in the beginning phase is in the beginning phase.
Okay. So if you want to grasp on OSCE, you need to know what OSCE is, what is the information gathering, what is diagnosis, what is treatment, what they want you to say. It's not about getting some notes from somewhere. No. I'll just let you know that in my first attempt, that's what I did. But after that, I know that there's nothing like notes. You need to learn that what they're asking, and then you need to be like, you know every dentist is different. You need to be different. You just need to have a good information. Don't listen lots of people. I have did this. I failed my first attempt, and then I was searching, I will get some OSCE partner and all that. I'll get some tutor. No. Sit down, read what they have told you, what Academy have given you. Read it till you get the concept. If you need to read it 10 times or 20 times, just read it and then get back to them. Try to read, people answer the questions in the Telegram. I have I got a lot of information from people whenever there's a question, and every person have a different kind of explanation. I Every time my phone is with me, and every time I go with them, I took the screenshot of them as well, just to, like, whenever I have read this, that person have explained it better. That's how do you learn. So be active on Telegram. It will be hectic. I'm not going to say that it will be easy. It will be hectic. You'll be like fed up of everything, but it is what it is. You need to give this.
Yep, I agree in this. Guys, Telegram means our Telegram group, okay? It's the
Yeah.
Academy Telegram group, guys.
Yes.
Because some candidates said which Telegram group.
Oh,
So
sorry. I'm so sorry.
yeah, that's okay because the candidate asked which Telegram group. So it's guys our Telegram group, okay?
Yes.
The Academy groups. Now there is Doctor. I don't want to miss any question. Doctor Srisha,
Yeah.
how to manage study time after doing work?
That's a very good question.
This is the most common question.
Yes. So work depends. Like, if you are being an assistant here, you'll be tired. Okay. And that's where everything comes. You're tired, but I think just 10-minute or 15-minute nap will work. Or you need someone with you who will push you. That's where a study partner comes. Or when you get a question from Academy, like, that okay, let's discuss this question. You just read that. If you don't have a time, just keep playing that thing in your brain, so that once you get home, your your tiredness will get overpowered with the help of that question, because you wanted to find that answer of that question, and you wanted to answer that in the group. And that's where your tiredness will be. Okay, I need to get back. See, working, I think it's a push. You make you feel like that you're doing hard work. Before, I was watching people that, oh, someone quit their job and all that. I'm like, nah, these things doesn't work like that. You need to work, you need to study, you need to balance. That's what life it is. And
Yep.
I hats off the people, I've what were my motivations also, that people with their kids have passed the exam. And I'm like, if they can't do that, I can't even manage this job.
Hmm. Look, because most of the candidates actually they work.
Yes.
Yes, I agree on this one. Dr. Larry, she says, as always, right? He says, big congratulations, dear doctor. You know Larry, right? Larian, right?
Yes, I know her.
I have a question besides mock. Do you have any other advice to improve technical work for part two? Larry, come to the academy, Larry. Okay? That is the easiest way, Larry.
See, Dr. Larry,
Yes.
I understand. You were the, like, I would say, you were the first person. I always read your explanation, to be frank. Whenever your name appears in the telegram, I'm like, okay, I need to learn what she's saying because she's very good. If you talk about technical, I failed pretty badly in my first attempt. But after that, one thing Dr. Mansi told me that you need to do mock and you need to I did. I'm telling people that just do 4 mocks. I did 6 days in a week doing a mock till I get that point that okay, I'm okay. I can do this. That's what it is. Like, practice till you get better. Don't don't target for perfection. I was getting to perfection first, but then academy told me that don't go with the perfection first of all, because that's where your confidence get loose, because no one can get things perfect. You need to just fall into the criteria and do that much hard work that your hands will tell you that okay, I'm done, just stop it. My wrist was aching uh, every time when I just stop my work technical, but I was just like, okay, you can't let me, leave me here. You need to be with me. I just do massages and everything, and I get back there.
Yes, doctor. I agree. Larry says, Dr. Larry says, I know Dr. Bido, but I want to hear from her. I'm just kidding. You know this, Larry, okay? You know this, Larry. And that's only because I want to see you, Larry. That's it.
Yeah.
Okay. Dr. Shaman, doctor, I have a question as well. How to be amazing like you? Wow.
What was the
Get
sorry?
flattered by, yes, like you, definitely, yes. I don't know, but seems like it's you. No one here. You are the queen today. I don't think he means me. I think yeah, definitely he means you.
Well, I didn't
He
understand.
said, he says, daughter, I have a question as well.
Yeah.
How to be amazing like you?
Um, I don't know. I think I learned about myself in this path as well. That sometimes I get a lot of positive. Like, I imagine myself that this is what it is. And to be frank, my mother, um, she's the person every time I tell her that mom, it is going wrong, and she's like, just believe in yourself. If your mother can do this, how long she's come from those hardship and everything, you can. And I think that is the force. I'm like, if she can do it, what is this exam in front of me? Just think like that. That you need to get this. Just don't think whatever people will tell you. No one will support you. No one. It's what I have experienced. No one will. They will say those things which will hurt you so bad that it will just break you into so many pieces that you will be like, okay, I can't do this. But that's where your guts and your willpower will come. If you want that thing badly, now no one can stop you. Even God needs to change everything for you if you want that thing. Just do your hard work. I know it's very easy to say, but today when I got my result, everyone's saying, are you happy? Okay, I'm happy, but I have no words to explain. I'm just silent. Why I'm silent? Because I know what I have heard from people, what I have made my brain to go through, and how people helped me. I got really good friends, and my study partner, he's not even like helped me, but he helped me emotionally as well. He is the person who always pushes me. That's okay. Don't think about anyone. Just do it, do it. And I really, really wish that he should pass. Everyone should pass, I would say.
Yes, he's actually means. He says, I mean, Dr. Mankolkor. See, I was right then.
Is
Uh,
it is it Shimon?
Yes, he's your study partner. Seems like, right?
I don't want to
I
take his
expect,
name.
I
He made
expect
me.
him, I expect him the same when he said that, but I don't want to say it.
uh,
And
uh,
by the way, he's going to pass too. I'm
yes,
sure about this.
he will. He will. He will.
Yes,
He
I'm sure
will.
about this definitely.
I earned him in this journey. That's what I told
He's
him.
very good. I know. Dr. Sherman is very good. I met him in the academy as well, so I know him very well. I say him. I think Dr. Sherman, I saw you last week, right? So I know you're very good, Dr. Sherman. Okay, Dr. Hash asked question. Doctor, may I know how much hours you have to study per day for both part one and part two? What do you think?
Okay, part one, I don't even remember, but I'll let you know that I've told you that I didn't even count the number of hours. My mom just give me my breakfast, my lunch on my table, just on the table. I am not even.
You're really lucky.
Yeah, that's what like. That's why I just wanted to meet her. Like I just wanted to dedicate this thing to her because she never went out. She just, and my father also. He's like, go study, 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 and that's what you need. And I think with the God blessings, I got a very good husband as well. He's also like, okay, go study. Don't think about anything. Just go study. That's what you need. And about the, if you ask about part two, don't count how many hours. If you have some work, do your work. See, you need to cut down some of the working hours. Okay. But if at your circumstances you won't, just be prepared that you need to work hard much more. You need to sacrifice some of your nights. You need to sacrifice all your, I would say, peace for some days, and then you can relax for some days, I would say. But I just barely remember that I only had 3 to 4 hours for myself in a day. Other than that, it's all ADC. It's all my technicals, OSCEs, everything.
Okay, I think this is the best answer then. Yes, thank you very much. Okay. She's okay. There is you, Doctor, before and the Academy are always the best support. Thank you, Doctor Larry, for this. Doctor Larry, oh, he is amazing. Doctor Shaman, yes, he's amazing. Shaman, you are amazing dentist and kind. Australia needs dentists like you. Very good.
Yes.
Yeah,
Yes.
Dr. Shaman just says, Dr. Shaman says, yes, we met last week. Yes, I remember this, Dr. Shaman. We will. Okay. There's a question here. I don't, guys. Don't forget any of your question. By the way, I'm trying to do my best, guys, to get to your questions. Dr. Kanika says, please give tips for technicals.
Okay.
By the way, sorry for this, Dr. Gatra as well, because I don't forget any question. Dr.
Okay.
Gatra say tips to clear effective communication. So now we need two tips.
Hmm.
One, tips to clear effective communication. Two, tips for technicals.
Okay. In first attempt, I do fail my effective communication. What I have learned is let them talk, let them get involved. Once don't be scared if you see that they are getting involved or they are asking a lot of questions. That a positive sign. That's a positive sign that you are doing well. That's what I have encountered this time. They were asking in between questions, and I was answering that. Go with the flow. Don't be, there's nothing like script. Nothing. It's all about, once you know the concept, your brain will let you know that, okay, this is what they're asking. Watch them, what kind of expression they are giving. Because, as we are talking to someone as a friend, we do get to know that, okay, he's not interested or he wanted to explain. Just see that what they want to listen. Focus on their expressions just like a human being. And if they want to stop, you just stop. Don't, because what I have learned that you don't need to finish that OSCE. You just need to be a dentist and a patient relation. That's it. And once you achieve, they will give you time to, you know Hello. Yeah. Hello.
Guys, am I wow? Guys, am I audible? I was talking, but seems like no one guys hears us.
Yes, yes, doctor. Like, uh, you got like there was no.
Yeah, I don't know why. Like even I don't know.
Like,
Okay, I was even talking, no one heard us. Okay, Doctor Marco, that's fine then. So
yeah.
guys, what I was saying is, okay, guys, what I was saying is, okay, Doctor Marco, you already answered the question for technical
Yes, sir.
when you said the most important is criteria, and I believe in this because that's actually what I keep saying, right?
Yes, yes.
Okay, this is very good then. Okay, just now sounds came. Okay, very good then. I believe, Dr. Manko, we have covered as much as we can from today's session.
Yes,
We've
doctor.
been here since I think more than 2 hours right now, and you know
Yes.
what? I'm very, very proud of you.
Thank you so much, doctor.
I'm very happy. I'm very proud of you. You made everyone of the in the academy very happy. You and the 9 champions pass the exam. You guys great, and I believe everyone here will pass the exam too. And you guys going to achieve your dreams. What do you think about this? Did you trust me when I said you're going to pass the exam? You trust me now? You believe me now?
Yes, doctor. You know,
You see?
that's what main thing is that you need someone who trusts you that you can, and that makes your trust doubled, I would say. Then you have a hope that you can. That's what you need.
Yes. And be honest to you, not
Yeah.
everyone should be trusted, but the candidates really they do the good job. That's the people we trust, and that's why when I see really the candidate doing the great job, I feel very happy to tell them you all gonna pass the exam. But when I see them don't do any job, I say, guys, you will not pass the exam. Like I'm very honest about this. I'm very clear and honest about it.
That yes, that's very right, doctor.
Yes. Thank you very much, Dr. Manko. And again, congratulations to you and to your family and everyone. You have done, I would say, the biggest dream ever in your life because this is not you just only gonna help you. It will help the family. It will help your kids, your husband,
Yeah.
and then it will help your mom and dad and
Yeah.
friends and everyone around you. So this
That
is the big step ever in your life. This is going to change all your life, I believe.
yes. Yes, doctor. That's very correct. That's very it's a life changing thing. You are
Yeah.
something, and then when you get the results, you are like different person.
Yes, I agree with this. Okay. So thanks very much for this. I believe you have give all the tips and tricks for today's session.
I don't even imagine, doctor, that I'm the person who is giving tips and tricks. I never thought that I'm going to stand here and guiding someone. I never imagined that way.
Look, I knew it gonna happen one day. As exactly I knew that everyone is here.
Yeah.
especially Dr. Shimon because he's your study partner, Dr.
Yeah.
Larry because she's always active and she's doing good work,
Yes.
and everyone here, guys. I believe, guys, you all gonna pass the exam. Believe me.
Yes.
Once you pass, I told you this. I told you, believe me. Once you pass, I will remind you. I'm
Yep.
gonna remind you right now, right? And
Yes.
then same things for these people. They pass, and then once they pass, I will remind them too.
Yes, doctor.
No problem. Thank you very much, also. Then have
Thank
a
you.
great night
Thank you
and
so
great
much.
night, guys, to everyone of you too. Thank you very much.
Thank you so much, doctor.
Thank you very much, you guys. Bye, bye, guys. Thank
Bye.
you very much. Thank you.